Looking to add cheekbones with fillers. What kind of filler should I use to achieve cheekbones? I'm looking to add natural looking contour and don't want to scare anyone.
Thank you for your question. You've submitted a single photo and you're stating a question that you want to know what kind of filler should you use to get a natural looking cheekbone. And you go on to say that you'd like to develop this natural looking cheekbone, but you want to avoid scaring anyone. Well, I can certainly understand your concerns. A little bit of background: I'm a board certified cosmetic surgeon and fellowship trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I am very familiar with, and I use the wide range of fillers every day in my practice. And so I could certainly understand your concern about not scaring anyone. And I'll share with you my approach to helping people achieve cheekbones. To further elaborate on the fear of scaring people, I think that one of the things that our patients have become extremely sensitive to is the fear that they're going to look like they're bloated, or they will have these round apples in their cheeks, and they see some famous people they'll ask, my patients will ask me, these people are so famous and so rich, how could they end up looking this way? Well, certainly I can't comment on why and how they ended up exactly looking that way, other than there may be some combination of their perception of looking good and their doctor's perception of them looking good. So, but to go further into detail of the approach to cheekbone enhancement, I'll explain to you a little bit about the anatomy that's relevant and that's important. When you look at a face and you define a face that is youthful and attractive, there's something called the golden ratio, which is essentially, regardless of ethnicity, is almost a universal ratio of beauty, of attractiveness. And it basically is a 1.6 to 1 ratio between the upper part of the face, the lower part of the face at different points. Basically, the cheekbones looking a little bit wider than the lower part of the face creates this nice angularity, what people describe often as like a model look. Well, the cheekbone itself is not just one area. It represents an area that starts in the front and goes all the way towards the back, towards the ear. So when I look at someone like yourself and I want to see what is the optimal point, this is a discussion we have in consultation, where I'll show you exactly and I'll draw on the area to show what the area that I would probably enhance, or I would aim to enhance, so that you and I are on the same page. But there's one concept that I think will be really invaluable in this approach and avoiding looking like you'll scare someone. And that is the level of the tissue that the cheekbone enhancement is performed. I'll explain further. Essentially, the standard approach to enhancing the cheekbone area, or to create cheekbone, is to place the filler in the soft tissue or just below the skin. And that is perfectly fine for a lot of people, but I feel like that doesn't really give you as good definition as what we do in our practice, which is called structural volumizing. Structure, meaning the bone structure, is really what is defining the cheekbone. We refer to it as a cheekbone. And so when I place fillers to enhance cheekbone, I place it at the cheekbone level, below the muscle, well below the skin. So there's skin, there's a little bit of fat, then there's muscle, and then there's the bone. I place it at this level, and it creates this nice enhancement and more of a well-defined appearance that really creates a nice looking cheekbones. And so I think that it's certainly achievable. Now, as far as choice of filler is concerned, we again live in a time when we have very good options. We have longer lasting, thicker fillers, such as a Juvederm Ultra Plus or Juvederm Voluma, which has a viscosity, has a strength to it that can allow for this sculpting and molding, and can last for more than a year, and technically can last, like a Juvederm Voluma, can last up to 2 years. So there's the choice of filler, and then there's the method of placement, and very importantly is the style and the artistry of placement. And so I think certainly it is achievable. I think, again, this is without a physical examination, and have to see how much elasticity of the tissue there is. But I think you would do well with structural volumizing to get that subtle but natural look that certainly won't scare anyone by doing structural volumizing. Again, that's my opinion, and I think, but from experience, I think that would work out well for you. Using a long-lasting filler, such as Juvederm Voluma, would also be my filler of choice at this time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.